If anybody knows northern Bolivia, you might recognize where I am right now. I'm in Cachuela Esperanza, right on the border. Looking across the river, you'll see Brazil, and I'm still in the Bolivian part, in a village that was once very famous and very wealthy. There was a big family here exporting rubber from this town, and they were very successful until somebody took some rubber trees and took them across, I believe, to India, where they were more organized, and eventually this town fell to ruins. But I thought I'd come here and have a look as part of the work that I'm doing to set up a surgical visit in Riberalta, which is a big town in northern Beni, Bolivia. And I thought I'd just mention some of the things that that we've had to do. So today I'm on a scouting trip looking for what we can do on our day off, and I think this is a really beautiful place to bring my team, just to show them a little bit of what Bolivia is like. So yes, I think it's a good place to come on our sort of our halfway point of our trip. This trip, I had a number of things that I needed to do. So firstly, I went to Trinidad, which is the capital of the Beni, and I wanted to talk there to the Ministry for Health about a big program we want to run to find people in the Beni that have glaucoma. Probably, if Bolivia is like everywhere else in the world, 1.5% of Bolivians have glaucoma, and therefore we potentially, with our population of 500,000 people here, we potentially have 7,000 odd patients that have glaucoma, and a third of those won't know they have it. A third of those that perhaps do know they have it just don't comply with medications, partly because the village pharmacy where they live just doesn't supply them, or it may be that because of the cost is prohibitive. It can cost up to sort of 300 bolivianos, which is about, I suppose, 35–40 pounds per month. Which is a month's salary for some people. So if you're earning £1 a day, to spend £1 a day on glaucoma medicines just doesn't make sense, and people just stop and they leave it, and they hope that the problem goes away, but of course it doesn't. So we're going to try and find those people with a big nationwide, a big department-wide campaign, and that will take place in April, and then we will treat those patients with a laser so that they can go back to their houses and not have to worry about using eye drops. So that's all planned, and I wanted to go to the Ministry for Health in Trinidad, get their permission, which I was able to do, and then come to Riberalta, which is the first place where we're going to try this new program. We're going to use artificial intelligence for some of the diagnostic tools with an ocular coherence tomography, and we're going to treat with lasers. So it'll be our first for Bolivia, and it's very, very exciting. And I also want to bring my surgical team here for June, so we're going to plan to do about 150 operations on eyes that are already blind, but blind with things like cataract, which are repairable. So once we take the cataract away and we insert a clear acrylic lens in the same space, then then we have an advantage. Looks like my light has just gone out, so I have to continue without it. So yes, so I had my trip to Trinidad, and then I drove up another 15 hours to Riberalta, where I had a good 2 days meeting with the mayor, who's very happy to help support our trip. And then I went to the hospital and spoke to the hospital director and to the administrators and to the nursing team in theatre, and got them to understand what we were looking for in terms of the cleanliness of the operating theatre and how we want everything set up. So that was good and very positive. There is an ophthalmologist in Riberalta, but he doesn't operate, so he doesn't see that many patients. There's probably 1,000 blind people in Riberalta, and not many of them have access to good treatment. So we went to see him, see if we could support him. He's happy to collaborate with us on the surgical trip, and so that was a good starting point. And hopefully we'll get to know him over the next few months and see where we are to be able to help him with his practice, and obviously to try and identify patients for both glaucoma and for our surgical trip. So that's been my trip. It's just been a few days in Riberalta and Trinidad, just getting ready. It's 6 months to go before our surgical trip and 4 months to go before our glaucoma trip. So you need to allow quite a lot of time just to overcome any obstacles, get all the legal papers done and permissions for everything. But so far so good, looking really good. I'll add a few clips of Quechua Esperanza for you now, just so you can see a little bit of the town that I'm in today. But that's it, quick update from the Andean Medical Mission.